I'm Artemis Teagan, and I am the director of the Artemis Center for Family Therapy. We're going to be meeting today with two of my very esteemed colleagues, Dr. Marjorie Rand and Dr. Dennis Coffey, to talk about mindfulness in clinical practice.
I've referred patients to you with multiple personality disorder, but now they're called dissociative identity disorder. So do you use these techniques with those patients?
Well, it depends on how stable they are. I think mindfulness can be used in lots of situations. I think with people who are having dissociative episodes, I would want to be really careful.
And what you're talking about is a resource model of treatment by teaching the mindfulness so they don't re-traumatize themselves, that is, and that the pattern doesn't get stronger.
Right, because what we're learning in that cognitive behavioral component of mindfulness is that survivors of trauma create more injury because of the way they're reacting to the memory of what happened, right? That they're creating this pattern of, as you say, re-injuring themselves because they're attaching all of this particular reaction to it. That doesn't have to happen.
We want to keep that person in contact with us and present and grounded in their body and in the here and now. When that doesn't happen, the person will regress probably and dissociate and thereby actually making the trauma pattern more strong. So it's the presence, the contact, and staying in the here and now.
Yeah, and I was working with a gentleman who was having a pattern in his life where he was rescuing, doing a lot of rescuing, and then becoming really resentful of all of these people that he was rescuing. So we did a combination of mindfulness and integrative body psychotherapy. And what came up for him as he was tuning into what was going on in his body was a memory of walking his little brother across the street, and his little brother got away from him and he got hit by a car. And so he had carried that sense of failure and responsibility throughout his whole life and was reenacting this need to rescue people. So as that came up, huge abreaction, lots of pain, lots of tears, and I could see him wanting to kind of choke it all down because it was so overwhelming for him. So I just said to him, feet on the floor, eyes open, and I said, tell me what you see in the room. Right, so I grounded him back in the present. Tell me 3 objects that you see in the room. Tell me what you hear in the room. What do you smell? Can you feel the ground? This was enough to bring him back into the present so he didn't feel so destabilized. And he was able to come out of that and make the connection. And it was life-changing for him. He was able to repair his relationship. He was able to stop doing this rescuing behavior. And it freed up a whole lot more energy for him to just be more authentic in his life. I don't think there's anything more powerful than a trauma survivor learning that their internal world doesn't have to devastate them. That there's a different reaction that you can have. And also that the reaction can be not reacting at all. Being able to show them that we can do this and we can still keep you really safe. And we're only going to do this for short periods of time. That tends to be key. Small, 2 minutes, 3 minutes is all we need. Yeah.
Excellent.
Thank you so much for being a part of this. I really appreciate the participation. It's wonderful to have you here today.
It's a privilege.
Thank you.
Yes, happy to be here.
Thank you.